I'm Nyma from Nurse Nyma Aesthetics, operating out of Brisbane, Queensland, Australia, registered nurse, and today I'm going to be talking to you about why you need to stop wasting your money on hair regrowth fads, okay, including serums and all that sort of stuff. So I'm going to be talking to you about how you can save your money, essentially, and invest it into hair regrowth options that are scientifically sound and will actually give you the results that you're really looking for. So stay tuned if that is something that you are interested in. All right, so hair regrowth. It seems to be a growing trend. There is a lot of evidence to suggest that people are wanting these treatments. It's being searched for more and more. Hair thinning, hair loss, pattern baldness, those sorts of things. It all falls into the hair regrowth, hair regeneration umbrella. There's loads of gimmicks out there, honestly. Like, I go through my feeds and it's like, try this hair regrowth serum, or try this, stick this on your head for 30 minutes every day, and it's just like, I'm sort of shaking my head like, no, people don't fall for the hype, because we do, as consumers who don't really know too much about the science. You can be vulnerable and fall for the advertising hype. And look, if it's going to make you feel better about yourself, go for it, buy it, put the serum on at night and stuff like that. It's fine. But look, today I'm going to tell you about where the evidence is, where you're really going to get your bang for your buck. And look, if you do have pattern baldness, or you've been diagnosed with one of the forms of alopecia, then this video will be really helpful for you, because I'm sure you'll be searching for something that's going to help stimulate that hair growth. Okay, so let's talk about hair. Let's talk about the pathology of the hair. So ultimately, you've got your immature hair strand, which is your vellus hair. So it's like your little baby hair, and it's like a little thin, immature hair strand. And you've got your little root shaft here, and the little baby vellus hair sticks out like that. So that's basically what the hair can revert to. Okay, so with your androgenic alopecia, which is your hair thinning and things like that, which is the most common one. So it can go back to the vellus hair. So it's not necessarily like you go completely bald, but you've just got these hairs that are just hiding in their little follicles, and they've just they're hiding, and they don't want to come out anymore. And then you've got these beautiful big, they're called terminal hairs, that are like your thicker strands. They're obvious, they're popping out looking like this. So yeah, that can happen over a period of time. They go from terminal, thick, juicy strands to little baby vellus hairs. And so with the treatment structure, what we want to do is we want to target these baby little vellus hairs and get them to pop out to their little follicles and become terminal big daddy hairs. Okay, so people are looking for things online and things like that, like serums and all that sort of stuff. But I'm going to just tell you, I'm so sorry if you're someone who sells serums and stuff like that. Look, it's just not going to work long term. You're just not going to get the results. And a lot of things out there in the market, as soon as you stop them, your hair's just going to revert right back to where it was. So, that's your serums and stuff like that, and these fancy lotions and potions. Like, I was on the internet the other day, and I was like, far out, it's like a whole package of things you put on your hair to stimulate hair growth. And the thing is, like, people, when you stop using it, your hair's just going to fall out again. So you're almost like bound to them for the rest of your life. And I don't really know if people can afford that, or if they have it. I think there was like 6 products in this one package. And look, in my opinion, that's not sustainable. That's not a good life for me, if I have to, do that much with your hair just to get it to grow. So yeah, no, just try and stay away from things like that if you can. Obviously, definitely, if you're noticing hair baldness and stuff like that, do speak to your GP, because as someone who is going to professionally specialize in hair regrowth, me, I would actually like to know if there is a formal diagnosis, because that's actually going to change slightly some of the settings and things like that I'll be working on your scalp with, to avoid scarring and things like that. So we definitely need to know through your doctor if there is any formal diagnosis. Plus, it could be something that might be treatable as well, so that you just don't know about. So yeah, definitely speak to your GP. Now, your GP as well. Some popular treatments out there on on the drugs on the market, yeah, I suppose. So that's like your minoxidil and your Regain. So they're very, very popular oral and topical treatments that GPs have been prescribing for a very long time. It's a little bit hit and miss though, unfortunately, because minoxidil is actually a blood pressure medication, so sometimes people can have these side effects that people aren't really tolerating too well. But for some people it does work really well for hair, and other people not. So that's a problem with some medications. You just don't know if you're going to fall into that category. So definitely just, you can always try that, because studies have actually shown that minoxidil with other treatments have actually improved hair growth quite significantly. But once again, these tablets, you need to take them and continually take them for the rest of your life. So you need to weigh up what you are prepared to do and make that judgment. So there's minoxidil. There's also a few other medications out there on the market as well, but again, they're actually not specifically for hair regrowth. There are other things, like I think one of them is spironolactone, which is a diuretic. So people were having issues with urinating constantly, like frequently, and having a few other issues generally with their well-being. Another one of the oral ones is also I think it's like a male hormone, and you take that one and then you start growing facial hairs, or hairs where you don't want to, and it affects like sexual dysfunction and things like that, because it's actually not for specifically hair regrowth. So, but some people very well tolerated, awesome results. So again, that's a GP land thing. So there's that option which you could do, but again, you kind of have to be on it for the rest of your life, which is kind of a bit sucky. Alternatively, something that actually works, also, sorry, I need to say it, stay away from Ashley and Martin. They are honestly the biggest cons. So I'm sorry, Ashley, I'm sorry, Martin, I'm sure you're nice people that can afford to be on the regime for the rest of their life. But again, you get onto the system, which is super expensive, and if you stop, it stops. The hair stops growing. That's not a solution to me. Getting onto a solution that's actually going to be a long-term effect is that's what we're looking for here, okay? So science shows some of the best forms of hair regrowth is in combination, usually with a few things, but one of the scientifically most sound areas of permanent hair growth is through general stimulation, which is your skin microneedling on the scalp, and it's also your PRP, platelet-rich therapy. Okay, now PRP is obviously something that needs to be done by a registered nurse, but studies have very conclusive, like people say it's not up for research. Well, there actually is, you just haven't found it yet. So there's actually quite a lot of research around PRP. And its efficacy on hair regrowth. So what basically happens is, with your microneedling, what you're actually doing is you're stimulating blood flow to that follicle, okay? And it's not that you necessarily grow more hair, but it means that the actual hair follicle grows in size and diameter, and the actual vellus hair becomes thicker and it's stronger. So that's hair stimulation. It's under the general stimulation percutaneous microneedling, but you have to be very careful that the practitioner knows what they're doing, because if you're doing the skin needling, you can actually break away the hairs if they're not doing it properly, resulting into more trauma of your beautiful hairs that you're trying to preserve. And you can also cause scarring, which will make the situation worse. So you need to go to someone that you trust, but microneedling is definitely up there for hair regrowth. But if you're doing it in combination with PRP, it just completely intensifies. And if you can take an oral, hair loss option with your GP, if you can do all three, I mean, that's a game changer. Like, if you can tolerate it, like, that's amazing. So it depends on your situation, depends on you as an individual, it depends on how much it bothers you. Alopecia areata is probably a little bit more significant and noticeable, because it's like the proper bald patches, whereas the androgenic alopecia, which is like your patterned hair thinning and things like that, it's probably You know, you might not need to be on a risk going onto an oral medication for that one, but your PRP and your microneedling together is absolutely perfect. So with PRP, what that's doing then is it's actually, you basically have to get someone to take your blood, spins in a centrifuge. Which centrifuge and what type of tubes they're using is significant in the bang for your buck. So don't think you can just go to anywhere and they've got PRP advertised. No. You want to get your bang for your buck if you're paying top dollar. Okay, so have a look at my next video if you want to know more about that. But yeah, the machinery and the system, the technology behind it is going to determine how many platelets in your blood are actually preserved and then re-injected. So they spin it, separate your plasma. Your plasma is full of growth factors, okay? And then those growth factors and then spilling into that hair shaft and producing growth factors, stem cells, blood flow, all that sort of stuff, which is going to help build up that hair regrowth. So it really is amazing because it's natural, it's your own body, it's your own plasma. There's barely any reactions, if anything. It's a bit of inflammation, a little bit of bruising. So the good thing with microneedling, there is research there to state that it is used for drug therapy, so to actually drug delivery. So if you open all of the pores when you're doing the microneedling, it opens up a pathway so you can actually pop the plasma on top, and it does go down to that root. So the science is there. It's in black and white, and there's multiple randomized controlled trial studies that are very sound to show that microneedling with PRP is the way to go if you're looking at general stimulation hair therapy. Yeah, so I'm really excited that I'm going to be one of the first in Australia to have a beautiful machine from Europe. It's actually used for orthopedic surgeons, so the concentration of the platelet that you actually preserve from the blood is far superior than anything that I've actually seen here in Australia. So I'm really excited to get that machine. Definitely going to get your bang for your buck, so I can't wait to produce really beautiful results with the PRP and microneedling. Additionally, on top of that, if you want to just go even further, you can actually introduce some light therapy, so LED in combination at the end of your PRP and your microneedling is just going to stimulate it even more. It's just going to draw blood. It's going to stimulate the blood flow with the light therapy, and it's going to just do it all again. It's just going to stimulate, you know, all of that beautiful nutrients to help the hair grow. So yeah, there's multi-modalities that you can pick, depends on the seriousness of your condition, but it's definitely something that I'm really passionate about. I think that if you're going to invest any money in your hair, do it once, do it right. And just stop wasting your money on these gimmick serums, because literally you're just throwing it down the drain. However, if it makes you feel good and you're happy with it, then go for it. But yeah, hopefully that video helped. Definitely check out my next video on the treatment that I'm going to be offering at my clinic in Brisbane. And you can also go to my website for more information, which is nursenyma.com.au. All right, have a lovely day. Thank you. Stay safe. Bye.